I'm Kaylee Gladwell.
And we chose developing clinical judgment as our topic for intro. Preferably good clinical judgment, not bad. The reason that we chose this was that it interested us, and also that we had 2 weeks to choose it.
Yes.
And we didn't know what we want to talk about. Anyways.
But we feel like it's going to help all of us overall.
Yes, and because we as students are already facing this. This will continue throughout our nursing career, and also we wanted to know how to increase our clinical judgment to where we become more confident in our clinical experience, i.e. the hospital.
Yes.
This topic is too vast to explain in whole, so we just focused on a few key features of the subject. And also, this nursing clinical judgment is one of the most important parts that a nursing student will have to learn.
It incorporates all the skills you can learn.
Yes.
It brings it all in.
Basically, the whole clinical experience is designed for that reason. So even if a nurse does not know the exact answer to a problem, a nurse with good clinical judgment will narrow the possibilities down to a few different ones and will usually make the correct call. The development begins the first week of nursing school and is included in the way our nursing instructors teach us. They design the test so that a student will think critically and analyze a situation and then act on your decision.
So what is clinical judgment? Laster says it's the ability of a nurse to take in a variety of conflicting and complex factors and make a decision based on the knowledge and experience that you have attained. A guidance tool has been developed by Alfred Lafray in the form of 9 key questions that lend to clinical judgment focus. Without going into much detail, the 9 questions include: what major outcomes do you expect after the plan?
This wasn't planned. Keep going. This is
This
is question 1.
Oh, question 1. Okay. What major outcomes do you expect after the plan of care has been terminated? What problems or issues must be addressed to achieve the outcome? What are the circumstances? What knowledge is required? How much room is there for error? How much time do you have? What resources can help me? What perspectives must be considered? What is influencing my thinking? Is that all of them?
Yeah, I think so.
Good job.
Okay,
This is only a guidance. This is only a guiding tool because clinical judgment cannot be obtained abruptly. Eventually, with the experience, the nurse will be able to reach a level that is of a professional standing. So how do you use it? Tanner finds that a nurse's initial grasp of a clinical situation starts a reasoning pattern to interpret the situation and determine action. Even when a nurse is put to a situation where they do not immediately know the answer, they may use a hypothetical deductive reasoning to reach the correct conclusion. The best way to make an educated decision is to use the key skills that we are being taught right now, which would be to use the right physical assessment of your patient to further your knowledge of the situation and narrow the possibilities down. After making the decision and implementing it, the best way to determine if that was indeed the correct answer is to observe your patient and determine if further action is needed. Once a nurse has had a great deal of clinical experience, they may immediately notice the pattern that they have seen before in the current patient and implement something before actually assessing the patient and confirming their immediate impressions.
So how could this be better taught in nursing school? At first glance, it would seem that more clinical experience would be the best way to develop good clinical judgment. This may not be the case because if a student is not first taught the basics of nursing fundamentals, they can be more of a hindrance than a help to the staff at the hospital or the clinic or whatever.
And some of us may have already experienced that thus far. Hopefully not.
Another way of helping this development was suggested by Moy Standing, who suggested that nursing students be taught about a 9-step system to obtaining good clinical judgment. This program shows there are 9 steps that a nurse will go through in developing good clinical judgment. This includes all steps from a novice nurse to an advanced nurse. It begins with the nurse using experimental research and analyzing it to reach the correct judgment. Survey research is next, which is followed by qualitative research. Action research is the next one, and this is done by the nurse personally. So at this point, you're using your own experiences to develop clinical judgment. It progresses through patient and peer added judgment, your coworkers and your friends, and will lead to retroactive judgment. It then terminates with the nurse intuitively knowing the correct answers to most of the situations that they will encounter. This is due to them having encountered something like this before. Knowing these different steps will help students know where they are at on this continuum and what they need to do to progress.
And a side note would be that me and Cody actually find these steps to be very beneficial, and we as students want to keep them in mind as we further our education.
Yes.
So what can happen after the development of clinical judgment is mostly complete? After developing good clinical judgment, it will have a major effect on the way you care for your patient. But with this skill can come overconfidence, as shown in an experiment at the University of York in the United Kingdom. Taking part in this study were nursing students and experienced nurses. The experienced nurses were found to be overconfident, where the nursing students underconfident. In neither case did it benefit their clinical judgment. It was found to be more beneficial to have a more balanced confidence level that correlated well with the ability to judge the clinical situation. The experiment also showed that time restraints led to more accurate judgment being made. The conclusion was made that more time only led to an increased possibility of confusion and less confidence.
So, in conclusion, the development of good clinical judgment is a long process that begins the first week of nursing school and will continue until the person becomes an expert nurse. This is usually after 3 to 5 years of workplace experience. It will not really stop there, though, because with the changing in times of the medical field and the many different things that we come in contact with, there will always be a continuation in learning and thus developing clinical judgment. There is also a very real possibility of becoming overconfident, which will not help you in the least. And there will be, so to help out with new nurses, there needs to be there could be more teaching in nursing school to educate us as students as to what step we are currently in on the 9-step continuum. And knowing this will help us as students understand what step we need to obtain to continue our development of good clinical judgment. And I think that's it.
Yep. Thank you for listening to our presentation, and we hope that it helps in some way, and I hope everybody has a great Thanksgiving break.
Thank you.